Okay, knock knock. Hi, I'm just going to be performing a newborn assessment on your baby today. I'm going to put the hand sanitizer on, get my gloves. I'm also going to be checking the room for safety, which it is safe.
What's your name there, Susan?
My name's Naomi. I'm just going to be performing this newborn assessment today.
First off, I would check
I'm going to go ahead and check everybody's wristbands, mom and dad's, and then the baby's as well.
I'm just going to say I see it here.
That's good. Okay. So first, when I start my assessment, I'm just going to be checking the baby's head, making sure that the posterior and anterior fontanelles look good, which it does. Here I'd also be looking for any molding, if the sutures are overlapping from birth, and I'd also be looking for any milia, stork bites, or caput, which this baby does not have. Next, I'm just going to move on to the face. I'm going to look at the baby's eyes. They are symmetrical and in line with the ear, so that's good. I'm also going to be looking at baby's nose, making sure that's symmetrical, which it is. I'm also going to check both nares to make sure that he can breathe out of both, which that's good. Then I'm just going to look at baby's ears, make sure that they're symmetrical, making sure that it's responding to sound in the room, such as mom's voice. And then I'm also going to check the pinna, so that's good. I'm also going to look in baby's mouth and make sure that that's symmetrical, see if there's any Epstein pearls or any teeth. So that all looks good there. Then I'm just going to go ahead and start by looking at baby's neck, make sure that it has range of motion. I'm going to palpate the clavicles to make sure that they feel good, which they do. Then I'm going to look at baby's chest. Baby has 2 nipples, very small breast buds, which is good. I also feel for the brachial pulses here. And I'm going to listen to baby's lungs really quickly, and then I'll take the respiratory rate for 1 full minute.
Yeah. Thank you.
Okay.
And that's the cheesy thing on the baby, and we leave it on because it's fat up, it's natural moisturizer for the baby. And there's the acrocytosis, which is the hands, feet show blue, but that's also normal for these newborns. Other findings would include the million, as well as some eyes. I know there's 2 types though, but it's clear gray. Okay.
Well, what are the slight differences? What is another name for it?
Digital. So the units must have 3 different names then.
So those are things that I would just have a conversation with her before I touch her.
Dark.
So we can take a
Okay, everything sounds good there. Baby's respiratory rate is 55, which is normal. I'm also going to listen to baby's heart and take the heart rate for 60 seconds.
Usually both male and female, the private areas are swollen. Then female, well this is a male one, so I said female anyways. Female, check for secretions like mucus or pseudomenstruations.
And then I'm going to help
for the male. Just feel if I can feel any testes. And there should be 2 testes in the scrotum. And I do. Okay, okay. Oh. Rewind. Actually, no, it's fine. Okay, so we're supposed to also feel the femoral pulses. Regular pulse. Yeah, as long as I remember. And because baby's in the nude right now, fully nude, I'm just gonna turn the baby.
Okay, that was 1 full minute. Everything sounds regular there. Heart rate was 115, which is normal for this baby. I'm also going to be taking the auxiliary temperature. Baby's temperature was 98.2, which is normal for the baby. 98.2. Then I'm just going to look at baby's abdomen, making sure it's rounded. I'm going to listen for vowel sounds in all 4 quadrants. Okay, and everything sounds normal there. Next, I'm just going to assess the umbilical cord, making sure that all 3 vessels are present and that I don't see any signs or symptoms of infection, which I don't, so that's good.
Okay, so the movement for the baby.
Okay. So, next I'm just going to do a skin assessment on the baby. Color looks good. I don't see any pinkish purple hands or feet, so that's good. I'm also going to look and see if I see an amelia, erythema toxicum, stork bites, or
just making sure. It's hard to
slate gray nevi, which I don't see. Okay, so then I'm just going to perform a genital assessment on baby. This baby is a male, so first I'm just going to make sure that the consistency is good. Everything looks like it should. I'm also going to palpate the testes to make sure, or palpate the scrotum to make sure that the testes are there, which they are, so that's good. I'm also going to palpate the femoral pulses, which are strong and good. If this baby was a female, or I would also, if this baby was a female, I would just be looking for overall consistency as well. I'd be looking to see if she has any discharge. It could be mucus or slightly pink because of mom's hormones. And then I would feel those femoral pulses again. I'm also going to check and make sure that baby has an anus, which he does, so that's good. Then I'm just going to pick baby up, turn him over. I'm just assessing the spine, which is midline. It feels good, so that's good. I'm also looking at the gluteal folds, which are there and intact symmetrically.
Oh yeah, thank you. Assess the length.
I'm also going to be assessing baby's hips, so I would move them up towards its chest and then rotate them outwards and then back down.
What are you checking for when you do that?
There, I'm just listening for any popping or clicking. That would be not normal. Okay. So then after that, I'm just going to be looking at baby's range of motion. I'm going to check the range of motion in his arms, which that's good. His legs again, also good. I'll be checking for his leg length. And then I'm going to count and make sure he has 10 fingers and 10 toes, and making sure that he has creases in his hands and his feet. So that's good. Then I'll be looking for the activity state and the tone of the baby. Right now it's just quiet. Seems a little bit sleepy, which is totally normal for right now. He's not crying or anything. Then I would start by checking his reflexes. So for his startle reflex, I'm just gonna hold him, hold his arms together, and let go, and his arms should flail, which that's good. I'm also going to be checking his walking reflex. So I'll hold the baby upwards against this surface, and then he should make a stepping motion, which he does. Then after that, I'm just going to check his rooting reflex by brushing his cheek, and he should turn his face that way. After that, I'm going to check his sucking reflex by just putting my finger in his mouth, and he does suck on my finger. Then I'm just going to check for his palmar reflex by placing my finger in his hand, and he wraps his fingers around my finger. Then I'm just going to be checking his tonic neck reflex by turning baby's head, and one arm should go up and then out in the direction that he's looking. And then I'm going to be checking his plantar reflex by placing my finger under his toes, and he should wrap his toes around my finger. And then his Babinski reflex by stroking the bottom of his foot, and then he should fan out his toes, which he does. So everything looks good with baby. Do you have any more questions or anything?
What is our common skin finding on the back?
On the back, I would just look again for that slate gray nevi.
Perfect.
That would be around his buttocks.
All right, and then we are going to talk about shaken baby syndrome.
Okay, so shaken baby syndrome is when the baby gets shaken in an unnatural way. It causes some neurological damage. So in order to prevent that from happening, if you're feeling ever like that may happen, or you're concerned about it, if the baby's screaming, you can go ahead and put him in a safe place like his crib and just leave him there, shut the door, and as long as he's crying, that means he's okay. So,
Yep.
yeah.
I tell parents you want to make sure that baby's not hungry, they're
Okay.
not too hot, too cold.
Okay.
Check for hair ties
Okay.
around fingers, toes, and
Okay.
for little boys' penises, because
Okay.
they need a hair tie around the
Okay.
penis. And sometimes babies just cry.
Yeah.
It's exercise for their lungs.
Uh-huh.
And yeah, you put them in a safe place, and the grown-up gets a time.
Yep.
That's okay. Perfect. Good job.
Thank you.
I'm gonna transfer this onto this one.
Okay.